Hello, today we'll be discussing about diseases of bones involving maxilla and mandible. So in this first term is osteogenesis imperfecta. Now osteogenesis imperfecta is autosomal dominant. Predominantly it is inherited as autosomal dominant trait, and occasionally it can be autosomal recessive also. Okay, and why this osteogenesis imperfecta occurs is due to defect in type 1 collagen, and this type 1 collagen is present in sclera, bones, fascia, tendons, and dentine. Okay, and why this defect occurs? This defect occurs due to mutation in gene. Which gene? You need to remember these: col1a1, col1a1, and col1a2. And these two genes are present on chromosomes. col1a1 is present on 17q21. Okay, you can see one here and col1a1 here, and col1a2 on 17q22. Okay, a2 on 22, a1 on 21. Okay, and why this osteogenesis imperfecta occurs is the fetal collagen fails to mature, and which leads to osteopenia. What is osteopenia? Osteopenia is tendency of the bones to fracture. The bones fracture down easily, and there may be also defect in bone healing also. So the babies, they die shortly after birth. This is the main defect in osteogenesis imperfecta. And other feature, which is the main highlighting feature, is the thin sclera in osteogenesis imperfecta. The sclera of our eye is very thin, and we can easily see the chorioid which is present beneath the sclera because it is thin and which is of blue color. So we'll see sclera as blue hue of sclera we can see in osteogenesis imperfecta. So we'll see sclera as blue hue of sclera we can see in osteogenesis imperfecta. And now this blue sclera is also seen in osteopetrosis. You need to remember these. These are very important. And fetal rickets, Turner syndrome, Paget's disease, and Marfan syndrome, which is very, very important. Marfan syndrome. And one more, Ehlers-Danlos syndrome. This is very important, Marfan syndrome. You will find MCQs on this. Blue sclera is also present in osteopetrosis, fetal rickets, Turner syndrome, Paget's disease, Marfan's, and Ehlers-Danlos syndrome. Okay. And after this, one more other feature which you will see is there is hearing loss. Why this hearing loss? Because the bones get there occurs bone sclerosis, osteosclerosis, which we call it osteosclerosis, which leads to compression of the nerves, and this leads to hearing loss because the nerves get compressed, and which this leads to loss of hearing. Now there are 4 types of osteogenesis imperfecta. 4 types. We'll write it down as type 1, type 2, type 3, and type 4. And we'll see only the main features of these 4 types. In type 1 is the most common, which you need to remember. Most common is type 1, and most severe is type 2. Type 2 is most severe. And in type 3, in type 1 and type 2, there will be hearing loss. Okay, hearing loss. And in this, no hearing loss in type 3. And in type 4, and one more thing, in type 2, the baby dies in less than 4 weeks because it is very severe. So the baby will die in less than 4 weeks. You need to remember this. Baby dies in less than 4 weeks. And type 4 is again subdivided into 2 types. We'll write it down here. Type 4 is subdivided again into type A and type B. Type A is associated with type B is associated with opalescent dentine, and type A is not associated with opalescent dentine. Dentine, become very thin, and you can see the brownish tint of the pulp. in type A. In type B. And in type A, there will be not any O plus and dentine. In type B, there will be O plus and dentine. So there are 4 types. Type 1 is the most common one. Type 2 is the most severe one. Type 3, there will be no hearing loss. In type 4, hearing will be normal. Here also no hearing loss. Okay. And further, it is subdivided into 2 types, type A and type B. O plus and dentine in type B, and no O plus and dentine in type A. Okay. Now we'll see the radiographic features. Radiographic features. Now the radiographic features will be, there will be osteopenia of long bones. Osteopenia means bowing, the bones, there will be bending of the long bones. Osteopenia. And as the collagen fails to mature, there will be multiple fractures of the bones. There will be multiple fractures. And there will be present Wormian bones. What are Wormian bones? These are small sutures in the skull which fail to fuse. Small sutures which fail to fuse, or I will write it down, small sutures in skull which fail to fuse. These are Wormian bones which fail to fuse. And other thing which we will see is maxillary hypoplasia. Maxillary hypoplasia. The maxilla will not be that much developed in osteogenesis imperfecta. And as the maxilla is not developed, there will be unerupted first and second molar. The first and second molar will be unerupted. This is also very important feature. You need to remember, the first and second molar will be unerupted in osteogenesis imperfecta. And if we will do the lab diagnosis, we will see there is increase in phosphorylase enzyme. Increase in phosphorylase enzyme. This point also you need to remember. There are MCQs in Pulse on this. There is increase in phosphorylase enzyme, and it is all about osteogenesis imperfecta. And one more thing, histological features. Now you will see in osteogenesis imperfecta there will be widely separated bony trabecules like this. These bony trabecules are widely separated, and this you will only see in osteogenesis imperfecta. And the bone cortex is thin and porous. Now these I will write down here only. Widely separated bony trabeculae and thin bone cortex. These two are histological features of osteogenesis imperfecta. Now that's it. Now we'll move on to next one.